Welcome back, comrades.
Blackman noted that many bills regarding reproductive rights are often targeted at women. Well, why is that? Women have 15 forms of birth control. Men have 2. Put a Jimmy on or pull it out. Women have 15.
The birth control pill. What nutrients can that deplete?
Boy, quite a few. They have studied this quite in depth, actually. We talk about it in my one book, but most of the B vitamins are depleted by the birth control pill. Now, one of the problems with that is in women, when you start getting low levels of B12 and folic acid, 2 B vitamins, you're more apt to get abnormal pap smears.
Women who take hormonal birth control are priming themselves for the kind of men that have lower testosterone.
Yep, big
Menstrual
topic.
medicine can be really beneficial for a bone break or an artery that needs surgery.
Exactly.
But when it comes to anything of a chronic nature, is definitely where it falls
To
short.
unplug their bananas.
Welcome
from their
back,
ears,
comrades, to
open up their
NutriRebel,
eyes,
where
and
we
they can
try to
see.
make integrative ideas great again. And in this case, the integrative ideas are the subject of birth control. And many women take birth control for the main purpose they use them is to avoid pregnancy. Although this is the most prevalent reason, these pills also provide additional advantages. They say they're advantages, including the regulation of menstrual cycles, alleviation of cramps, and possible decrease in the risk of certain cancers. But they have major side effects. And have you ever wondered why you're getting these problems in the first place? You're not short of drugs, that's for certain, because your biochemistry is messed up, along with gut health. And what are some of the side effects? The studies have shown women become attracted when they're on birth control. They become attracted to feminine-looking men. And your doctor won't tell you this in a short 10-minute office visit, but why do you think a woman is attracted to the guy on the right there, Justin Bieber or whatever? When they're on the birth control. When they're not on birth control, they're probably attracted to Brad Pitt or the guy in the middle. And look at the bottom left there, all the side effects of all the nutrient depletions of various drugs out there. You don't. When you take these drugs, what do you think happens? It distorts your biochemistry. Many people don't think about these things. I did, but I didn't
There
really
used
know
to be
the
accountability
details.
for women. She got pregnant. Boy.
And now we have content producers like this. They basically only stick to the concept of the merely psychological.
That shouldn't have happened. How'd that happen? Well,
The number of women now.
And they kind of concentrate only on women and men relations, but they don't talk about the details like
Who've
this.
had to get on thyroid drugs because they took birth control is immense. It also lowers free
And they say you go on thyroid drugs because of birth control.
testosterone by as much as 61%. So now women are less fit and less toned because they're imbalanced in that hormone as well. And it increases your risk of depression by 130%.
Therefore, you get so-called mental illness from taking, not just from taking, this is a big reason why they get them. They get these symptoms because they're taking birth control. But that's not the only reason. The main reason is what goes into your mouth, right?
And there are more serious side effects. I'm not done yet. Birth control also decreases your preference for facial masculinity. So women on birth control are more attracted to men with more feminine features. However, when they get off birth control, then they want a more masculine man.
All right, this happens a lot.
And you wonder why so many people are staying single, especially men. Like, we're just as sick as a society.
Patient starts on oral contraceptives, and up to 50% of the time, around 6 to 12 months later, they start getting depressed thoughts and have a prescription for an antidepressant.
So you go on birth control, then you take antidepressants, then you take thyroid drugs. That never stops until you're in a casket.
Here's what happens. As the body breaks down estrogen, it uses up magnesium and B vitamins as well. And the body needs those things to build neurotransmitters.
Yeah, like serotonin,
like serotonin.
And your gut makes serotonin as well. Your gut-brain axis, because all your body is connected. Does your doctor talk about all these interconnections? No.
So when you're thinking about birth control, the first step is really understanding what your genetic profile is, what your family history is, what your gut health looks like, what your liver health looks like, and then are your nutrients optimized to support birth control? Because as you go on something like the birth control pill, we're finding that it actually depletes the body of key nutrients. And those include your B vitamins, magnesium, for example, is another one, zinc, and even some of the other minerals.
So here are some of the contraceptive effects on females. All the interconnectedness, all the interconnections. Copper excess is a big one. And you can see on the graph there, top right there, all of the major nutrients affected by only birth control, right? Smoking and high alcohol intake deplete zinc. And you can see zinc in the graph up there. And correspondingly increased copper as on zinc and copper work inversely to each other in the human body. Effects are emotional problems, behavioral disorder, mood swings, depression, and nephritis and schizophrenia. Why do you think people, this is crazy. And number 2 is candida, that's a yeast. Repeated use of antibiotics and birth control pills can develop candida. The immune system reacts to allergens by releasing histamines, leading to common immune allergy symptoms such as cravings for sugar. See, sugar is up there. Bread or alcohol discomfort after eating fruits or sweets. Strong reactions to chemicals, alcohol intolerances, digestive issues. You can link all these red highlighted points to the graph up there, like diarrhea or constipation and rectal itching or bladder infections. Number 3 is magnesium deficiency. Birth control pills deplete magnesium which is essential to calcium metabolism. But it also can be easily removed from their body by diuretics like coffee, alcohol, or prescription medications. Even drinking too much water can deplete magnesium. Together with calcium, magnesium helps control muscle tone, which is vital for the heart's function. Additionally, magnesium is essential for calcium's effectiveness and helps activate vitamin D. So look up all these red points. Number 4 is zinc deficiency. Birth control pills suppresses zinc. Zinc is essential for forming tissues and cells, maintaining taste, healing wounds, supporting insulin function, producing stomach acid. It is linked to early hair loss and found in high amounts in the prostate. Zinc also boosts the immune system by regulating white blood cells, increasing T cell production, and improving wound healing. And also, underactive thyroid is a big one. Eventually, you increase your risk significantly by taking birth control pills of underactive thyroid. That can lead to a variety of health effects, including fatigue, weight gain, and sensitivity to cold. Underactive thyroid is linked to iodine and selenium and deficiency. It is linked to increased levels of mercury. Mercury is a toxin, because mercury displaces iodine. It is also linked to other glands of the endocrine system, adrenals, gonads, pancreas, and pituitary. Look up all these points up the top right. Lactobacteria. Birth control pills make the bowel more acidic, increases the incidence of fungal issues. Lactobacteria are important for intestinal immunity, indigestion, bloating after meals, intestinal gas, especially after sugary foods. Diarrhea or constipation. Urinary tract infections, yeast infections, candidiasis, cold sores, canker sores. And the next one, vitamin B6 deficiency, also a very big one. Women who are trying to tone muscle or lose weight, who are on the birth control pill, will have difficulty without supplementing of this nutrient, B6. It seems that whenever there is an increased levels of estrogen in the body, there's more B6 required. Therefore, estrogen increases. Yeah, we need more B6 often when you're on birth control, and PMS as well. Causes B6 deficiency. Carpal tunnel syndrome is also linked to B6 deficiency. And it's linked to B6 is needed to maintain a normal intracellular magnesium level. And the last one here is folic acid deficiency. Taking medications or birth control pills interferes with folic acid absorption and metabolism. You can see all these interconnections. And it's not overwhelming if you get someone like me. You can take the free symptom measure tool at the bottom to see what the interconnections are. And it's a lot lower cost than you think. And I can even do it for free if you can't afford it. But here's more details.
In 1950, we used to lock them up forever.
Yeah.
In 2007, we lock them up with their drugs forever. There's no difference. They said they may be worse off today because they're also being destroyed. Their body chemistry is being destroyed by the modern drugs, which didn't happen nearly so much with the old drugs.
So therefore, we have to remember we're just like fish in a fishbowl. If the fishbowl is polluted, you don't keep putting drugs into it. You have to clean the fishbowl, right? But that's not how modern medicine works in a 10-minute acute-oriented visit. But anyway, if you like the content here, if it makes you laugh, please like and subscribe. And as always, take the free symptom measure tool on the bottom left whenever you have a chance to do it.